There is once again a new dominant variant of COVID-19. The CDC says EG5, also dubbed Eris by experts, counted for 17% of all cases in the U.S. as of last week. And then on Wednesday, the World Health Organization classified it as a variant of interest. So brace yourselves. Here we go again. Joining us, Dr. Payal Kohli. I feel like we haven't talked about COVID for a while, but it still exists. It's still out there.
It's still mutating.
I know. Well, yeah. And it feels like a lot of people, I don't know if we had this conversation, are like coming down with it right now.
Yes, so it is a summer season for COVID for sure. We're seeing increasing number of cases, but it's very different than what it looked like a few years ago, guys, because we now know that most people that get COVID infection, aside from the very young and very old, are likely going to have mild cases. Even with this new variant, we don't think it's going to be a big public health threat. So you might be asking, well, then why are we talking about it? Well, we're talking about it because it really helps us sort of determine where we're going with COVID and really re-emphasizing the fact that we still need to think about testing as a way to determine the strategy. And with fall vaccine season coming up, it becomes more relevant than ever what's circulating out there.
You said symptoms are so far mild. Is it different in any way from previous, or is it all the same?
It's pretty much the same symptoms. We don't think we don't have any data suggesting it's more infectious. We don't have any data suggesting that the symptoms are worse or it's more likely to end you up in the hospital. Now remember, the original parent strain was the Wuhan strain, right? Out of that came Omicron. Out of that came XBB. This is a subvariant of XBB. And the reason that that lineage is important, when we think about designing our vaccines next month, come fall, we need to know which vaccine is going to offer protection against what.
Yeah, and good time to talk about vaccines as we've got like kiddos going back to school and we're thinking about, flu shots. It's around the corner, as Jenny kindly mentioned. That fall is fast approaching.
I'm trying to hustle somewhere out of the way.
I was just like, let's go. But we've also been talking about, the news that we're dealing with more hospitalizations too from COVID.
We are, but thankfully it doesn't seem like it's from this variant. It actually seems like it's from changes in our behavior. So the fact that we're testing less, so that's why the World Health Organization wants to take this opportunity to remind people that even though we're not going to get super sick probably from COVID, if we're feeling under the weather before we go to gathering, we want to remember to sort of test frequently. And thankfully many of the medications like Paxlovid that work against some of the other variants will work against this as well. So if you test positive, don't just not do anything. Call your doctor and see if it makes sense for you to take Paxlovid, because there is good data that it'll prevent progression to long COVID. Now, as the variants evolve, our science knowledge also sort of changes, which makes it a little bit tricky to know whether something's going to cause long COVID or not, how early we should treat it and what have you. But yeah, with vaccine season coming next month, this year is going to look very different with that season.
And speaking of vaccines, I'm trying to remember where we left off. What is the current vaccine designed for, or are the scientists designing it now? And did we get that joint flu COVID shot yet?
So not a joint shot quite yet, but we are working on XBB coverage, which I think is critical, because at this stage, guys, if we vaccinate people against the original Wuhan, we're so many generations removed, we're not going to have the protection that we need. So I think a lot of scientists are using this as an opportunity to update the vaccine. This year we also have the RSV vaccine for adults over the age of 60. That's the first time ever. It's a vaccine, for the higher risk population, and then of course the flu shot. And they always like to say, get your vaccine before Halloween. So that's kind of the mark we have in mind in terms of when we'll see respiratory viruses peaking. Although the caveat is that, again, with COVID, things have been a little bit tricky.
Get your vaccine before Halloween. We can remember that. We will abide by it.
That's right.
Thanks, Dr. Kohli. Have a good one.